Hello, everyone. It seems like we're kind of tilting towards this side of the room. So sorry if I ignore the other side of the room. I'm so glad to see so many people here interested in this important topic. And yeah, some familiar faces. My name is Katharine French-Fuller. I'm a community engaged researcher. And today I'm going to be talking about the myriad of options that exist for different states to take to help mitigate the benefit cliffs. So I was asked by the wonderful people at Ogden Can to look at what states can do to facilitate upward mobility, remove barriers, and help mitigate the benefit cliffs. There's actually a lot of really great energy right now in the United States in terms of how different states are tackling this issue. Every state is kind of looking at their own reality, what the social, political, and economic needs of their state is, and kind of figuring out what makes sense for them. But there are literally dozens of state-level options that are available for states to choose from. And a lot of researchers and think tanks are writing reports and articles kind of stating what are the possible avenues for reforms. So that's really exciting. So this presentation is just to give an idea of the options that are out there, what other states are doing, and get the conversation going for what makes sense for the stakeholders here in Utah, right? Because every state is unique. So how did I go about doing this? I looked at what other researchers, policy organizations, state and federal agencies, foundations, think tanks, I think that about sums it up, what everybody else has said or done or recommended, and what they see as the low-hanging fruit, what is their North Star, what is their dream, and everything in between in terms of long-term solutions, short-term solutions, removing bureaucratic barriers to tearing down the system, right? There's a lot of ideas out there. But interestingly, a lot of times when you do this kind of project, when you're looking at what other people are saying, you can see a lot of disagreement. But interestingly here, I saw a lot of agreement about the different steps that states could take to mitigate the benefit cliffs. So that was kind of interesting to me. And all I did was take all that information and synthesize it into one document, in particular thinking about the realities of Utah today. So again, the document is meant to give ideas, to start a conversation, be a resource. I'm nerdily proud of the bibliography. Please look at the bibliography and look at all the other reports that people have written. So I am not a stakeholder in this, I'm not a stakeholder in this conversation, but I'm happy to answer some questions about what I found. Some of the sources that I looked at include, speaking about the employer perspective, include the National Chamber of Commerce Foundation, the National Governor Association's Foundation, the Urban Institute, National Conference on State Legislatures, Center for Policy and Budget Priorities, and of course the Department of Workforce Services here in Utah, their website. In total, I consulted 78 separate sources, and they all contributed to what I found for this project. Before I get into the substance of the report, I wanted to talk about what we mean by benefit cliffs, right? Because public benefits are a series of different programs like SNAP or food stamps, housing subsidies, TANF cash payments, which used to be called welfare, child care subsidies, SNAP. I'm sure I'm missing one, so I apologize, that people receive when they are low income and unable to pay the bills on their own, and they hit below a certain income level. So those are what public benefits are. What do we mean when we say benefit cliffs? The definition that I used for this project, that I used when Jenny Nagy and I worked on our survey in Weber County last year, and the definition that Nick technically used is that when you the loss of benefits means that you have fewer financial resources at the end of the month than before you lost those benefits. So you're actually worse off once you lose those benefits. And that's the definition that is used by Circles, the Federal Reserve of Atlanta, and a few other places. It's also not, but people kind of talk about it more broadly than that. And I've started seeing more organizations also have a sort of broader definition of what benefit cliffs mean. So you can also see it as like you lose your benefits and you're not self-sufficient. So you lose your benefits, but you cannot pay all of your bills on your own. So that's a definition that I saw used by the LEAP Fund, which specializes in benefit cliffs research, and the National Conference and state legislatures. I've even seen the definition simply mean you've lost your benefits, your income has hit a point, and you're no longer eligible for benefits. And economists like to talk about marginal tax rates, but I will leave that for the economist. So that's very technical. So basically, obviously the definition is kind of in flux. What are we saying when we talk about benefit cliffs here? So I think there's like a wide held consensus that the benefit system as it is currently functioning is not helping people get to self-sufficiency. And we agree broadly that this doesn't make sense. We want to have incentives to go back to work, to be self-sufficient, and we shouldn't have bureaucratic barriers that are stopping people from doing that, right? And that people feel stuck or held back, and we want to make systemic, programmatic, and bureaucratic changes so that we're not getting in their way, right? And I'm going to be drinking a lot more water than Nick did, so I'm sorry. Okay, so it's also important to understand that benefits are administered over a variety of agencies, and different states have varying levels of control over different benefits. So one of the areas where they have most flexibility is in TANF and in child care at the state level. Benefits like Medicaid and housing subsidies is much more control at the federal level. So because I was focusing on what states can do, a disproportionate number of the solutions I found are related to TANF, and actually also SNAP as well. Speaking to the confusion about the income levels, different programs terminate eligibility at different levels, right? So if you are a family of 4 in Utah and you are on TANF, your eligibility terminates around $15,000. Not exactly, I can't remember the exact number, but it's around $15,000. And if you are, but the federal poverty level is around $31,000, and you lose SNAP around $39,000. So there's a wide variety of income levels at which benefits terminate, and how they, so I'm just going to leave that there. And per your question as well, some benefits decline. You slowly lose money. Other benefits drop off sharply, but depending on your family composition and the kind of deductions you get, you could experience benefit cliffs or benefit terminations differently depending on your own particular family reality. So it gets very confusing. But oftentimes families articulate, as per Nick's data and the data that we found in Weber County and the national literature, and just actually looking at the self-sufficiency standards that exist, that families are not self-sufficient when benefits terminate. So that's the overall context of some of what's going on as I get into the solutions. And again, to emphasize, a lot of these solutions that can really, really change how the system works is at the federal level, right? So these programs were created by different legislation, authorized by different statutes, go through different congressional committees. I found this really amazing map of like how it works, but I couldn't get onto the PowerPoint. It just illustrates how confusing it is, right? And so we want to we want to just focus on what we can do at the state level to tackle the problems that were identified in the surveys and some of what like Marcella said in her quote and what you were talking about in your question. So one of the big issues is that families cannot pay their bills on their own when benefits terminate. So what are possible ways to tackle that? One way that different states are doing is they're increasing the income limits at which benefits terminate. We could do this in particular with TANF. Like I said, the federal poverty level for family of four is about 31,000, and it terminates here in Utah at about 15,000. We could also increase the SNAP income limit. And what a lot of states are trying to do is to utilize a self-sufficiency standard to guide those changes in the income limits. So there's a lot of cost of living calculators out there. You have the MIT cost of living. Alice from the United Way is a tool that you could use. There's another economic policy council that has a tool. And here in Weber County, we have the independent living standard thanks to Jenny Nagy and her students. So there's a lot of different ways that we could use, states can use a self-sufficiency standard to kind of guide policy changes, right? Another thing that we could do is increase and lengthen income disregards. So what are income disregards? Basically, when you qualify for a benefit, oftentimes a certain percentage of your income is disregarded, and you qualify based on that remaining income. So when you go back to work, you can increase the amount of income disregard that would allow for a transition over a longer period of time. Now, luckily, Utah does this for TANF recipients, and I think it's like 3 months. But some states are doing 6 months, and they're doing larger amounts. So something to, it's one of those continuous improvement ideas, right? We're doing well. Is there room to do a little bit more, perhaps? Sometimes there's a very large population of people who are low income in Utah, and not all of them are utilizing the benefits that they are eligible for. And, or they're living near or just above poverty, but they're not eligible for benefits because of asset limits. So for TANF in Utah, if you have $2,000 or more in savings, you are not eligible for TANF. So about 21 states have either increased asset limits to about $5,000, or they've eliminated asset limits altogether. Same thing with SNAP. We could see to increase or eliminate asset limits. So that would be a way to encourage savings, and that would also, as families transition into the workforce, it allows a little bit of cushion that will help them maintain stability. So as you transition into work, if your car breaks down and you literally have no savings, you cannot fix your car, right? And having a little bit of savings would allow you to continue going to work. To buy, the uniform that you need all of a sudden, your copay on your childcare, whatever it is. So another way that we can kind of work on fomenting more than we already do a culture of savings is also to individual development accounts have existed for a long time. They exist here in Utah, but I don't think they're very, very well known. So some states are really trying to promote the use of individual development accounts. And these are accounts that families can use to save for housing, to buy a home, for education, and for starting a small business. That's what it was. And basically a community-based organization kind of acts as the bank. You put in $5 a month, and then federal funds match your contribution. So every dollar you put in, it gets matched. And I think it's hard to imagine if you're this low income that you can save anything. But the idea that that we're kind of fomenting the idea of long-term financial stability is behind having IDA accounts. And also states like Maine and some other places in the Northeast are doing state-level savings accounts, like they call them rainy day funds, or other escrow accounts, like the HUD's family. Oh, what's it called? The HUD has an escrow account where you can pay money into as well. So the state rainy day fund, like in Maine, it's matched. You put in your $5, the state of Maine matches it, and you can use it to buy a car, replace an appliance, whatever it is. And the idea with this is it contributes to ongoing family stability. It gives you that cushion as you're transitioning to work so that you're a more reliable employee, right? And it decreases stress levels. And the last thing is that, as Marcella mentioned, right now, if you hit the income threshold, in a lot of states, you have to immediately report your income that you've gone over the income limit. And some states are experimenting with having averaging out earnings over a 6 or 12-month period. And that way, if you go over the income limit during one pay period, as long as you don't hit the income limit over the average of that time, you can keep your benefits. So this encourages working extra hours, working overtime, taking on seasonal work, that sort of thing. So that's something that some states are doing as well. One thing that comes up a lot is, again, like the confusion about benefits. It's amazing how dry your mouth gets when you're like speaking in front of people, but not when you're like just having a conversation. I don't get it. Benefits are confusing. No one's like, especially if you're on multiple benefits, keeping track of what income limits, what deductibles, the earned income disregard, like it's very, very confusing and time consuming. We've talked to people that have spreadsheets about trying to keep track of their benefits, right? A lot of states now are encouraging the use of benefit cliff calculators as part of like the case management or the coaching process, and at least you're like more certain about when you're going to hit that benefit based on your family, that benefit cliff based on your family composition, and how you're going to live out that benefit cliff based on all the different benefits you're receiving, right? Because for one person who might be on Medicaid, losing Medicaid if you're young and you're healthy, it's not great to lose Medicaid, but you'll be okay. If you're a high medical need family, losing Medicaid is catastrophic, and your behavior will be very different than the person who's losing Medicaid, who's healthy. So their response, their behavior will be very different. I think using coaching and coaching methods is one of the kind of the areas of interest that I've seen over case management, and I will go into that a little bit more in a second. And then going back to utilizing those income disregards for longer periods of time would help people be less fearful about you losing their benefits and averaging out the income over a 6-month period. And then we do hear a lot about people spending a lot of time applying for benefits, going through the eligibility review. Even in Utah, where we have this like fabulous one-stop shop, with DWS, there's a lot of time that can be spent, especially if you're like bumping on and off the benefits based on your hours. There's a lot of time spent on doing paperwork. So instituting broad-based categorical eligibility, which is basically you are eligible for TANF, then you're automatically eligible for SNAP. That's something that 44 states have chosen to do. Lengthen those eligibility cycles, right? Averaging out the income, and continue improving the data sharing practices across agencies. There's some important federal restrictions about how you can share data, right? But there's, I think there's a growing awareness at the federal level that those need to be clarified, and that those data sharing practices and data transparency is really key in making the bureaucracy less cumbersome. And then finally, like if you're gonna hit a benefit cliff, for families that do hit a benefit cliff, several states are experimenting with a pilot cash bridge program. So you give people the cash that they are losing when they lose their benefits, and see what happens. So Springfield, Massachusetts is doing such a pilot program, and my understanding it's being very rigorously evaluated, so I'm hoping we'll get some good data from that program. But now, so those are like the immediate policy wonky things that we can do that will make a difference in people's lives as they are experiencing being on benefits. But we can also look to like longer term solutions that are more focused on getting people to self-sufficiency and on upward mobility. So if we want to think about how to keep people off of benefits long term, then it's not, the question isn't just about fixing bureaucratic barriers or making these tweaks. We should still do that, but it's not just about that, right? So there's a kind of a mindset shift in thinking about this. So the very way these programs were conceptualized and are implemented, the way their metrics are set up is very much like a job-first approach, right? My understanding is that with TANF, it's like, did you get them into the job? Check, right? Whereas with more workforce development approaches, it's how long are they in the job? Did they progress? You know, have they increased their earnings? So if we actually conceive of the benefits cliff issue as a workforce development issue, we can think more long term, and we can focus more on how coaching can help the whole family over many years, right? So coaching is different from case management. I am not an expert on this, so if anybody else knows more, just like jump in right here, right? But coaching is different from case management because there's an emphasis on working with the whole family, the needs of the whole family, and addressing issues for the whole person, right? And it's not, case management is more focused on the program that you're working for. You understand when that cliff is gonna hit, you understand the details of that program, and a coach, a very good coach, would understand the whole picture and how it all works together for the particular needs of that unique family, right? They can also start addressing needs that are just outside of the purview of these federal programs, right? So financial literacy, maybe you need to improve your credit score, maybe you're behind on child support payments, maybe you need broadband access, you have transportation issues, right? All of the things that contribute to whether you're gonna stay off of benefits on the long term need to be addressed together. And every family situation is different, right? So coaching seems to be an intensive, but there's a lot of excitement there. And I understand that Ohio has a really great program that they're doing this with, which about 2 years of coaching, is that right? And then y'all in Tennessee are doing some cool stuff, but I will let Keith talk about that later. And again, we are lucky here in Utah that workforce services and human service programs are all under the same umbrella. So that's like way ahead of where some other states are. But I would love to get more details about how workforce development pathways take into account benefit cliffs. There are some really needy sectors, right, that are really desperate for workers. And workforce development has developed, like say for becoming an RN, pathways that you can take from being a CNA to an RN, but sometimes the benefit cliff hits and you don't continue progressing. So how can career pathways take that into account? How can we take advantage of the flexibilities that are possible in the WIOA funding to help people who are on benefits, on TANF, are experiencing intergenerational poverty, how can we particularly serve that population through workforce development strategies, right? And the Atlanta Fed has a great tool. So Atlanta Fed has a benefits cliffs tool that you can see when you hit the cliff, but they also have a workforce development and policy decision-making tool called Cliff that has an employer edition as well, so that employers can better understand when their employees are going to hit the cliff, and use that to help. That's great information. It can be used for policy making. It can be used by a lot of different people. And then my nerdy North Star is trying to align outcomes across agencies so that we are ensuring that we are working together and not in silos to help people get to self-sufficiency. Yes, all of these programs have their federal metrics and outcomes that they have to meet, but what other things can a state do to say, this is our definition of self-sufficiency, this is where we want people to be, we're all working together and we're going to try to meet those outcomes together. And critical in that is using a whole family, two-generation approach that centers the needs of the whole family, and which bridges the activities of any particular program. And when you're designing these amazing, beautiful, idealistic programs, no matter what, you have to keep the benefit recipient at the center of this process. So whatever it is we do, they have to be there designing alongside all the other stakeholders that are involved in this. So those are some of the short-term things that states, and that's just a sample, right? There's many, many other things that states can do in terms of short-term solutions, long-term solutions. But yeah, we haven't really talked much about employers so far, right? And employers can be a key part of this puzzle as well. People are saying they're struggling to find good, well-paying jobs that have benefits. Employers are saying they're struggling to keep hardworking, good employees. So there's a gap here. Do employers know about benefit cliffs? Do they know when they hit? Do they know how it impacts the realities and decision-making of their employees? So I think, educating employers about what this is, using the Atlanta Fed Cliff tool could be really helpful. So we could do some awareness raising, looking at how some states are incentivizing employers to hire TANF recipients. Some states are giving employers like a $2,000 payment if a TANF recipient stays working for them for 5 quarters or more. What are some alternative resources that an employer could give to an employee instead of a raise so that they don't hit that cliff, right? Is there anything allowable, because I know that gets really tricky, that an employer could do that is a resource that would help that person? And just making sure that throughout this process, we have the voice of the human services providers, the benefit recipients, employers, just having everybody at the table to make sure we understand the full complex picture, right? So I did talk fast, Leah. And just to summarize, a lot of states are tackling this issue. They're doing so. A lot of states are establishing working groups from the governor's office and looking at what the possibilities are and what makes sense for them. What are their priorities? What's the low-hanging fruit in their own states, right? What do they want to do? So there are literally dozens of bureaucratic tweaks that states can take to ease the immediate burdens of those on benefits. I just listed a couple of them. But I think a lot of states now are looking towards longer-term workforce development solutions to sustain upward mobility. And I think it's really critical that as we move forward to see what makes sense for Utah, that we take a human-centered approach and keep the needs of the whole family at the center of policy changes. So that is my very fast presentation. Thank you. man, really? Yes.
A lot of the things that are listed here and even some other stuff. So for context, I'm the chair of the Medicaid Advisory Committee in the state. So my focus is mostly on Medicaid. That's not to say that I don't know about or deal with other programs while in my professional role. But what we're seeing is a lot of proposals that kind of go directly against this coming from the incoming administration. Specifically more reviews, which would really complicate things. So I have a second job, I work at a bar, and we get more hours right now because the bar is way busier, but once January comes around, that's when everyone kind of stops going for a couple months. It's just the way it works. So if that was my main job, and I was receiving benefits, obviously, having multiple reviews would mean that I was on and off Medicaid. So I guess my question is, how do we navigate that when we know that a lot of these flexibilities that states are using are either being taken away or not approved in the ownership? Which is like asking me to read a crystal ball, which is
So the question was, if we're anticipating some changes with the incoming administration, how do we navigate that, especially if there's potentially more reviews of benefit eligibility? I don't have a great answer for you. I mean, the best I can say is that I think what I've been told by some people in the federal government is that they're not completely dispirited, that depending on the issue and how you frame it, that there is possibilities for reform that I think a lot of us in this room would be good with. That doesn't mean that specifically, it does feel like Medicaid has got a lot of heat on it right now. That doesn't mean that Medicaid won't suffer, right? So I think it's kind of a wait and see about how it actually rolls and how the rhetoric goes down as well, because a lot of it is political. But I'm hoping that in a general sort of sense that the work can continue, but that doesn't help you for Medicaid. So I'm sorry.
One of the demographics that I'm not hearing about in this discussion is our aging population. And Utah has an increased aging population right now in the country, and people are staying in the workforce longer. They're deciding that they're going back into the workforce because of economic reasons. Has that been anywhere in consideration when you talk about all of these issues that we're discussing here today?
So the question is, what about the aging population and older folks and how benefit cliffs are impacting older folks? Yes, I definitely came across research specifically talking about the unique issues of older folks hitting benefit cliffs. I can find you those resources that are in my notes, so I can tell you what, even, what's the main advocacy organization for older people? Thank you, AARP has research on it and things like that. But I cannot remember offhand like the particular needs in regards to benefit cliffs. So let me get you that information and we can have a conversation offline. You start in the back.
Yeah, so I'm just curious as to what areas of Utah is most affected with the needs of the resources. Is it rural? Is it metro? So
I was looking at what's going on nationally. So could I ask if there is, so he was asking what areas of Utah are most deficient in resources? Yeah, so if I could throw that out to the group, that might have a better answer than I would. For Utah specifically, right? Okay.
So you might be able to speak to Utah more specifically, but I think on a national level, and this is probably reflective here, the demand is pretty equal in both areas. It's just a different kind of demand, a rural demand versus kind of an inner city demand. So the demographics are going to look a little bit different. There is a greater challenge when it comes to people being able to receive assistance with actually applying for and understanding their eligibility for those, because there's just fewer resources in rural areas. They're more concentrated in urban populations.
But are you specifically interested in finding out what resources are available in rural areas?
I'm just trying to see the numbers, the statistics, where it's most affected, where resources are most needed.
Okay. Let me write that down and I will try to get you that information. Okay.
And Catherine, we're just running over time, so maybe
One more question?
I think be quick.
Stacy.
So kind of, I think piggybacking on your your last question about are we looking at what businesses are doing to mitigate some of these issues. So I guess in your research, was there anything about increasing the federal minimum wage? And I know that states have different minimum, but like $7.25,
Yeah,
who is living off of $7.25 an hour?
right,
So we're creating a problem.
right.
So-
It didn't come up because I was specifically looking at the literature on benefits, right? And that's not a benefit. Obviously, if you're making that much, you are on benefits. I will say, I was surprised that when I looked at reporting from the Chamber of Commerce Foundation and the Florida Chamber of Commerce Foundation, that their solutions aligned pretty identically with like Urban Institute, National Governors Associations. Like they were definitely recommending actions that included raising the federal poverty limit, that employers have responsibilities, and there wasn't this like stark disconnect, which I thought was really interesting. But in terms of the minimum wage, I hate to say this, but it was also outside the purview of the study, so I'm sorry. Okay, I'm told I need to end, so thank you so much, and I will connect with those people to get your contact information. So thank you.